So, I understand you have concerns about a low sugar when you're outdoors and may get too busy for regular meals. Does that sound right?
Yes, I really like spending time outdoors, puttering around in my yard and in the machine shed, and I don't have to earn a living farming, but I don't like just sitting around.
And I want John to be happy. But I worry that when he's out there, he may have a problem with low blood sugar, and I won't know anything about it. And I'm scared of what'll happen if he passes out.
Shane, you worry too much.
Well, I can't help that. I care about you.
You should be commended for keeping active and enjoying your health. So we should talk about how we can design a plan for you that is safe. Maybe even reducing some of the medication?
But how can we take care of his diabetes if you reduce his medication? I don't want him out there just eating candy bars all day. And I worry that if he lets his sugar run high, he'll have blindness and kidney damage. And I worry about him having an amputation.
You know, I'm really tired of having to do a finger stick before each meal and trying to adjust my insulin. I don't even have regular meals if I'm outdoors, and honestly, lots of times I just skip doing them.
Really?
Yes, I don't want my whole life to revolve around insulin shots and finger checks. I will do it if the doc tells me, but I want to know if it's really worth it.
So, it sounds like you both want the same thing, which is an approach that reduces the risk of a low sugar, but that also gives you the advantages of reducing risks of diabetes. In other words, you want to minimize the risks of treatment and the risks of diabetes.
Exactly.
Well, according to our evidence and recommendation from the American Board of Internal Medicine's Choosing Wisely campaign, we do not recommend using medication to target an A1C lower than 7.5. You have shared the things you're worried about, and now we know that trying to aim for a low A1C will not be any better for you than keeping an A1C between 8 and 9, but it will be a lot safer. The short-acting insulin you take requires frequent blood sugar tests and inconvenience. And the insulin and glipizide can raise your risk of a hypoglycemic reaction. Obviously, if you're outside working on machinery or something, a bad reaction could lead to serious injury.
So you're saying that we cut back on what we do to lower sugar. But for years we've been told that lower is better.
I know. And we are changing our recommendations. For people who are young and don't have any existing complications, we recommend lower A1C values because those people generally do better over time. But once complications have occurred, we know there is no benefit in lowering A1C down to 7 and 8. And we do know there is a lot of added risk in trying to get to those low A1C values. So we are trying to customize recommendations for John. The fact that you are active on your farm and you don't smoke is incredibly important and really helps reduce your risk of having problems with diabetes. And it seems to be a big part of your quality of life.
So you were saying that having a low A1C doesn't give me any more advantage than having one that's in the 8 to 9 range?
Right. My advice for you is just that. Advice for you. All my patients have different characteristics, but for someone like you, our best research tells us that keeping an A1C of 8 to 9 is just as beneficial as one less than 7, and it's a lot simpler and safer because we avoid the risks of the low sugars you are both afraid of. In addition, you're taking statin and aspirin, and these help reduce your risk of heart disease, which is a big problem for people with diabetes. And your blood pressure is well controlled with the lisinopril and with your lifestyle.
Well, I have to admit that it is inconvenient to keep checking my sugar and taking the mealtime doses of insulin. Are you saying I don't have to do those?
It's always your choice, but with how low your A1C is, and since we know there's no added advantage in the long run, I would recommend that we try to reduce or maybe even eliminate the mealtime insulin and the glipizide.
Well, I'm just very worried about what would happen if John passed out and I wasn't around. It's just so hard for me to get him to slow down.
I think your concern is a common one, and one that is supported by what we know about the fact that sometimes we can overtreat patients. So, would you like us to help you reduce the intensity of your glucose control We don't lose any advantage in controlling the complications of diabetes, but we make it a lot safer.
Oh, sure.
Sure,
That would be great.